We had to get our guests in. Excuse the traffic. Our guest is coming in right now. Dr. Dougbeh Chris Nyan is our guest. He's coming in soon. We just had to usher him in, so give us a little bit of a few minutes for him to come in, and so we can have a fruitful discussion. It's a pleasure to be here this morning. Happy Flag Day. I know we had to cut the feed live a little bit, but it's good morning, good morning, Doc. Thank you for coming. Thank you for coming. Our guest has just arrived. Welcome to everybody. Thank you, thank you. Thank you for your patience and understanding, everybody. It's a pleasure. Our guest has just arrived.
Good morning, Liberia. You're listening to the best show in these airwaves, the Eagle Talk Show, with your host,
Can we hear through here? Usually I don't wear I don't wear headphones.
No, you can hear it. Yeah, you will.
That's fine.
Can you get my pen? The pen. Okay, let's go. Ladies and gentlemen, thank you. We apologize for the little delay. We had to help our guests come in to the studio. You know, our roads and our traffic is bad. Without further ado, let me introduce our guest, the new director of the National Public Health Institute of Liberia, NPHIL, Dr. Dougbeh Chris Nyan. Thank you and welcome to the show.
Thank you very much, Majesty, for the invitation.
It is a pleasure to have you on here. Disclaimer, the doc know me from way back.
That's correct.
I wanted at the beginning. I used to get in hard time way back.
That's correct.
So that's my disclaimer. So y'all know. So everybody know. I told a lot of people that you were going to be on the show this morning, and I had the pleasure of going to your inductees ceremony for the new NPHIL director. It was a pleasure attending it. It was. I am glad to say, I am proud to say that this is one of the best appointments that President Boyka have made. Your role in the field that you are in, you have set a great example. I see everything that you have been doing for, as I would say, my generation. The work that you have done in the teaching and the teaching is that's the key for me. Teach a man to fish instead of giving a man the fish.
Right.
Is more important. And I from the bottom of my heart, I appreciate it. I'm grateful for everything that you have done and you will continue to do and what you are going to do at NPHIL. I know that you are going to do great things there. And I would say right now, I would like to say that if you ever need my help in any way, help, publicizing certain certain message that you need help with for it to go out to the public, I'm willing and able to help you anytime. Please don't be afraid to ever call on me for us to, for me to be able to help. That would be in the best interest of Liberia.
Thank you. Thank you very much.
I would like to give you my signal, say something to the listening public right now. If you know anything you want to say.
Oh, well, thank you first and foremost for the invitation. Just as you said, we've known each other from way back, and your contribution to the debate to make Liberia a better place cannot be overemphasized. Those were the good hard time that we gave me because we were back and forth with those kind of discussions. I personally always like to interact with personalities of very bright minds, and I've counted you among those very smart Liberian among the youth of Liberia that have improved my own outlook as to how things are in Liberia. Not that I don't know, but from a different perspective and from a very critical, sincere point of view, intended to move our country forward. So thank you for this invitation. I know it's long overdue, and we've been arranging it
Yes.
Here we are.
Yes.
Thanks also for coming to the induction ceremony.
It was a pleasure. It was a pleasure. So let me go into it. I learned something yesterday. I used the phrase monkeypox, and a young man corrected me saying that the WHO was saying so we shouldn't use the word monkeypox. We should use Mpox,
Right.
because the word monkeypox is equated from racism of in generation have equated black people to monkey. So he told me, said, don't use the phrase, we should call it Mpox. So that's something, if you can elaborate a little bit on that. I know right now we have this disease that is spreading in, I think I would say, East Africa, if I'm not mistaken.
Yes.
In East Africa, and from where you have put out, I think we have 5 cases in Liberia from where your institute have put out.
Yes. Before going into that, I just received a very sad news on my way here that one very important member of the NPHIL, which is the National Public Health Institute of Liberia, one important member of ours passed. We just got that news. He is Mr. Amos Telawim. He was part of the Division of Environmental and Occupational Health. So I want to say to our NPHIL family, and particularly the immediate family of the deceased, our heart goes out to you, and our sympathy and condolences go out to the Telawim family and to the entire NPHIL family, and of course to Liberia, because his work at the NPHIL was very important in the direction of environmental health care.
Yes, sir.
So I just want to say that out before we go into this discussion.
And I would like to extend my sincere condolences to the NPHIL family, to you, the director, to the immediate family, also to the rest of Liberia, because we have lost a treasure for someone who is working in that field. That is a treasure that we have lost as a whole, as a nation.
Certainly,
Yes.
certainly. Monkeypox, I will start with that word.
Yes.
Is a virus. Scientifically, we call it monkeypox virus. The disease it causes, we name it Mpox.
Okay.
Right. So that is the professional distinguishing semantics,
Okay.
if I can put it that way. It's just like how we have SARS-CoV-2 causing COVID-19. So it's the same thing. Monkeypox virus causing Mpox. So Mpox is the disease.
Okay.
Monkeypox virus is the pathogen.
Okay.
Yes, we know monkey in some part of the Western world has a racial connotation. So if the WHO director, or who, according to what you're saying, come out with trying to take away some sort of connotation, negative connotation from the word, that is welcome to us, the black race, who've always been associated with animals, etc.
Yes, sir.
So that is a psychosocial aspect of that. The virus has been around for a long time. It was first.
I'm glad you said it, because I know you got some people who got conspiracy theories out there who try to say that, if you go in America right now, you have some people saying, the West created a virus to wipe out Africans and so forth. You know, especially I think it's in Congo, if I'm not mistaken. And because of the war that going on in Congo, they would try to say that virus went into Congo to wipe out the Africans, the black people over there. That's what some people would try to, that conspiracy theories.
Right.
Yes.
And the virus has been around for a long time. We were first used to seeing smallpox, chickenpox all around. Yeah. And then came this new virus around the early to mid 50s, in 1950s, when a group of animals were being transported from Africa to Europe. And I think in Sweden, we first saw a case And there were other cases seen in other parts of the world outside of Africa. And when we see these things, we do a lot of studies on them to see what it is. Where is it coming from? How can we heal the sickness that it is causing? So we go, we do a backward study. And when they did a backward study, they found that, again, after the 1950s, when it came out, there was an outbreak again in various animals.
Okay.
So we definitely thought that, okay, this must have an animal source. And then tracing it back, there was an outbreak in the DRC Congo in 1970.
Okay.
Then they saw cases in Liberia also in the same 1970. So I just want to drag it right to Liberia. That in Liberia, we've been used to seeing this virus. It's not new.
It's not new.
And we have been having it under control. What we have been confronted with repeatedly is the smallpox and the chickenpox.
Okay.
As you will know, many children back in the days suffered chickenpox and smallpox.
Yes.
And so that's why we've been used to knowing, because it's been a major outbreak and epidemic. The widespread epidemic.
Yes.
Something breaks out, affects a lot of people in the population. And I want to speak as simply as possible.
Hey, please do.
these words so that the common person understands them.
Yes, sir.
So for our scientific and public health community, I will say the actual terminologies, and I will try to break it down.
Yes, sir.
So there were multiple outbreaks, widespread disease in the population with respect to smallpox and chickenpox. Now, when smallpox came about that time, there was something else that was seen, from the outward appearance of the disease that was not typical of smallpox. So this time around, public health practitioners, medical doctors, and other molecular scientists saw that there were a lot of what we call bumps, right? Okay, we call them rashes, we call them papules, we call them nodules, in the scientific term.
Yes.
In the simple term, we call them bumps on our hand and blisters.
Yeah.
At least blister, all of us can
We understand it, yes.
So we saw certain bumps and blisters that were much larger. They were bigger than the usual one we can see with smallpox and chickenpox. And then they have pus in them. Now, when we looked at that, we saw that those bumps were in the palm. They appear in the palm, unlike other.
Unlike on top of the skin. Yes.
Yeah, unless on top of the skin. So we were like, okay, is it the smallpox that is changing itself, or is it something new? When we look at it under the microscope, we did all the scientific study, we saw that it was related to smallpox, but it was not smallpox. So we have these diseases, these pathogens, the viruses, bacteria that come out to look the same, but they are not the same. They are like cousins. Let's put it that way.
Okay.
Right. They are like cousins.
They're related.
They are related.
Yeah.
So it was like a cousin of smallpox, and that's how we traced that in the scientific world and knew that it came from an animal source. And presently, to this date, we are not sure which specific animal is coming from. But one thing that is being clear is that these squirrels that you see around, some of them you found it in the United States, in the US, you have those squirrels.
The squirrel that's running all around and stuff,
We have squirrels here too.
Yes.
They are of different species, but we have squirrels in Africa as well. So we see that squirrels are the ones that harbor, meaning they are in squirrel most of the time. And because this virus is transmitted, meaning it's spread from animal to animal, we see that it has spread to the monkeys, and you know how much we have been in contact with the monkeys.
Yes, people eat a monkey meat
and we use that as pets.
Yes.
Also in some areas.
Yes, some areas.
Having monkeys as pets.
Yes.
So you find these monkeys mainly in forest areas. The DRC Congo, that region, have one of the richest forests in the world. Liberia also has one of the richest forests in the world.
Yes.
And our wildlife ecosystem is very rich. We have different species that you can find in many places. So no wonder why you will find these viruses when they come out in Congo. You also see the same thing happening around Liberia, Guinea, Ivory Coast. You find them around here. And so I just want to give the background to that.
Okay.
And that is how we knew then that this virus is a little different from smallpox, but they are related. And because we mostly at the time saw it in the monkey population, at that time we said it will be named monkeypox. So that's how it was given the name monkeypox virus.
Okay.
It's just like Ebola, how Ebola was named. It's just that Lassa, how Lassa was given its name. So it's the same thing. That's what we did.
Okay.
So that's it about the history of this virus called monkeypox virus, which causes the disease called Mpox.
All right. So okay, Doc. So now, I appreciate the explanation. I know our audience appreciate the explanation. So the next question: how can I catch the Mpox?
Very good. I didn't want to jump ahead of you. Otherwise, then the explanation will be so long, and then people won't find a break in between.
Yeah.
So now we know what Mpox is, which is the disease, or the virus, which is monkeypox virus.
Yes.
Now, how is monkeypox virus transmitted? Now, transmission means catching it.
Yes.
How? And they are transmitted to humans. It's expressed on the skin, right? So obviously we know that it's from contact to contact. You see how the animals come in contact with each other, and then we then come in contact with the animals.
Yeah.
So that's how we get it. That's the first and primary mode of transmission, that person to person or animal to person contact.
Okay.
So it's through person to person contact. That's how we catch it. Now it's in a human population, right? So somebody who is infected with that virus, if they come in contact with you, you're going to catch it.
Okay, so
if you lie down on a bed, and the two of you, that's why you see when one person catches it, the other person catches it, giving our social setting where children lie down on the same bed, 2-3 children on the same mattress, just as they catch chickenpox back in the days, or smallpox. So that's how you also catch this. So on the bedding, the virus will be shared, meaning it will be left there, because those blisters, that's where you found those virus. The virus happened in the mainly. So when those blisters burst out, definitely, it's left on the mattresses.
The DNA,
the whole virus is left there. And so when you now sleep on the same place, then you catch it.
All right, so let me break it down, trying to make it simple for the people then. So if I'm laying on the bed, let's say I got the Mpox,
right,
and I got the bump on me, all over me,
right.
There's a possibility the bone, when I lay down, one of the bumps is gonna bust.
It's going to bust.
It's gonna bust. So I get up and I go. Let's say I go outside.
Right.
How long? So as soon as anybody come in there and lay on the bed, they themselves will catch it too.
They will catch it too.
So no matter how long I have not been laying in that bed, they still gonna catch it.
Yeah, because you have left it behind.
Yes.
And it survives there for a while. And let us not go to how long.
Because the reason why, because I know, because I'm trying to debunk the conspiracy theories that is coming, that people are gonna come out there.
Yeah.
The same thing is that if somebody on the bed, if one monkeypox, do not go and lay on the same bed with the person. They did. Don't say, oh, the man been gone for 2-3 days. Yeah. So everything not die. Yeah.
Don't go there.
Don't go there.
So and that's where we'll come down to the symptoms. When you see these symptoms and you see that person has lied down on this bed, or they have sat on this chair, because our chairs got arms and they're rocking all on there, they're sitting there.
Yes.
Because the virus, the symptoms come all over you, and we'll get to the symptoms. But because of this particular symptom through which the virus is mainly transmitted, we want to deal with it, that person-to-person contact.
Okay.
Right. And we have people who like hugging each other, shaking hands, So if you shake hands and you hug, because the virus is all on your clothes. Once, those bumps are all over you, on your hands. And you can see them on the hands and the feet, which we call the extremities. Okay. So that's where outwardly you can see them. So once you see those signs, you know that this person is infected with the virus. In that sense, if the person leaves from the chair, it's good not to sit on that chair, because they would have left part of the virus on that chair. If they slept on a bed, certainly they left it on the bed. So if 2, 3 children,
if they drink from a cup of
from a cup because it's all over you, you will have it left on the cup that they drank from.
Yes.
So those things we have to be very mindful of. Then it is also transmitted. People can catch it through sexual contact.
Mm-hmm.
Now, in the scientific community and public health community, we have not yet specifically classified it as a sexually transmitted disease.
Okay.
But it's only because of the population through which it's transferred. It's been evidenced that it's transmitted from men who have sex with men, so homosexuals,
Okay.
Homosexual intercourse and contact,
Mm-hmm.
and there are other scientific reasons that can back that evidence. So
Okay.
we don't want to go into that for the purpose of our lay population.
Yes, sir.
Then, as we said, it's transmitted also through kissing. Like we said,
Yeah.
it's all over
yeah,
you.
yeah.
So you find those bumps all on the mouth of the person. Yes, you love the person, but you can't go and kiss that
them.
person.
Yeah.
If you do it, you're going to
Catch it too.
You know. So that's why we try to say that, and we'll come to the preventive measure and other regulations that we talk about.
Yes, sir.
So that is the manner in which you can catch this virus through person-to-person contact, sleeping on the same bed when that person is infected with the virus, kissing, that homosexual contact, and then
drinking from the same cup.
Then
Using the same wash towel, the same towel the person used.
Yes, the same towel the person used, the same bucket the person used. You know, you finish using it, then you think, okay.
Or the same clothes the person wear.
Let me just put a jumbo t-shirt on. Just run outside. You will catch it.
Yeah,
so you should be careful of those things. Don't use the same things. And we'll come to other things that we'll talk, because I want to just throw it in. That is why when we find that somebody has the disease, we take them and isolate them. We keep them away. Isolation means to keep them away from the other people.
When you may say isolate, it means that you remove it from your house and put you somewhere else where you will be eating by yourself,
and we'll treat you there.
That's it.
Until you get well.
So you get well.
Right.
That's what it means. Isolate.
Isolate. So we isolate you. We want to also say that the disease, as we have seen, is in medicine what we call self-limited.
Mm-hmm.
So meaning that when you catch it, after some time, then you can get healed, even if we don't treat you. But we don't want you to take that to say, okay, when I catch it, I will stay home.
like the COVID. The COVID
yeah.
stuff. People say, I just stay home. Don't take no medicine.
Right.
Yeah.
They say, I just stay home. I'm not taking any medicine. We don't want to say because of this, we are on an obligation to tell you everything about it, because we are obliged by public health practices and our scientific community to say everything.
Yes.
So that you are not left in the dark. But then we are saying to you that if that is the case, here is the situation. Every human is different in terms of how we react to these diseases when we get them.
Mm-hmm.
You may have strong reaction, meaning strong antibodies and those, the antibodies that science work, right?
Yeah.
But
so
army people that are in, we also army people in hospital that can fight diseases.
Yes.
So army fighters, body army fighters. Let's describe them.
And
they are in our body. So anytime we get a little disease, boom, they come around to say they're fighting back. So you may have less. Another person may have more, right?
Yeah.
Somebody have 12,000 army people. You have only 20.
Mm-hmm.
So when those people, when that thing come, definitely you who have 20 is going to overtake you.
So let me put it. So when you come, you look at when you. I'm gonna use a little medical thing, so maybe you can back me up or disagree with me. When you your army, when you get older, your army in your body gets resistant, gets smaller. When you're young, you know how when you're young, you think you can run over everything, you can overcome everything. Yeah. As you get older, your resistance,
your ability to fight back becomes smaller.
Yes,
decreases. When you are young, yes, you have that, but there are other people who we call immunocompromised people, meaning you can be young, you can be old, but for some reasons your immune system, meaning that defense military defense system that we have in UK may be weak.
Yes.
Very, very weak for any reason.
Any reason.
Right. So it has nothing to do with old, young, but we are asking you, when you get a disease, report yourself to the nearest hospital, nearest clinic.
So to everybody listening out there, I know what I said earlier about you be separated from everybody.
Right.
That this is something that is needed, because you got to think about your fellow Liberians. You got to think about your daughter, your son, your grandma, your grandpa, your auntie. They may not have the strong defense system to fight that disease as you are able to do it.
Certainly.
So you have to be isolated. You have to be put to the side, and you will be taken care of till you be in an area where you are there till they kill you. It's not to say you're not going to jail. So don't let nobody scare you. Say, oh, they're gonna put you in jail and all that stuff. No, that's not what's gonna happen. What's gonna happen is that you will be isolated, taken care of till you are killed, and then you will be put back. Go back to your normal life.
Yeah, we'll take very good care of you. So don't worry, nobody going to put you in jail. Nobody. So let me say it to you. So
yes.
We are the public health and medical people.
Yes, sir.
And say it to you that nobody is going to put you in jail. Nobody is going to handcuff you.
Mm-hmm.
Yeah, if there's anything, even if we have to bring the ambulance to get you, so that you don't get in a taxi and then infect other people, or get on a bus to infect other people, we will definitely make everything possible to come for you.
Thank you. All right, so now let's go to the symptoms. The symptoms.
Yeah. Now we've already dealt with one of the symptoms because it was important in the preventive aspect that we spoke about.
Yeah.
In how you stop it from catching it. One symptom that you can see visibly on a person's skin.
Mm-hmm.
But the person, if you are infected, it will come. You will have the fever, high fever. You will sometimes be coughing. You will have cough. And then those rash and the bumps that we talk about, those are the main things we want you to take note of.
Okay.
Right. So when you have somebody having those things, later on you will start seeing the rash coming on them, and so you start to take, because now it starts to express itself outward. Okay. Because somebody have fever, you will think, really, God, every day we say tough. That first thing that comes to people's mind here, even if they don't.
Yeah.
Then you think malaria. That the first thing will come to, and we are right for thinking like that, because that's what we are used to.
Yes. Yes.
But then later on, if you see the person coughing, the person sneezing, the person then they start having this bump and rash on their hands, on their feet, and on their body. So mama, look at your children when you start to see these things, because children are much more vulnerable. Mm-hmm. Meaning that children catch it more than big people. Yeah. As the statistics.
Because they are always out there playing everything, each other and all that stuff.
Contact, yeah. So they are the ones who are much more prone to catching the disease than older people. Okay. So when you see these signs on yourself or on your children, you should know that that's something called smallpox or chickenpox or monkeypox. Since we are in the monkeypox era now, just think that my child will have monkeypox. Bring them to the nearest medical facility.
Okay, so do you guys have a number, or you guys create a number that people can call to for us to for that when people see symptoms or things like that they can call?
We are reactivating that number.
Okay.
To be very frank with you, during the COVID, we had it running, and for some technical, administrative, and logistic reasons, for our people, for some reason, simply for some reason, the number was not in use. Okay. And so now we are activating it in order to have a serviceable, which is the 4455 number that has been used. That anybody can call toll free. Toll free means whether you got units or you got units or you got data, you get data, you can still dial that number and call. Right. Once we get it working, then we'll inform the public that this number is working now, so you can call it. Okay. But now we can't tell you that it's working. We're still working on it.
All right, wait, when the number is working, please send it to me so I can share it on my social media. I can share it out there. Definitely share it out there. So okay. No, what else can you tell us about Mpox, monkeypox?
Now, we've dealt with what it is, its history, we've dealt with the symptoms, we've dealt with the transmission, how people can catch it. Now the treatment.
There we go.
It can be treated with some of the medications that we have around, which we call antivirals. We can treat them in medicine against virus.
Okay.
We can treat them with some antivirals. What we are trying to do is to prevent. Now in Liberia, as we said, we had previously had 5 cases, and then when I stated in the press conference that there was a case that we had that we didn't process it in our detection process.
Okay.
And we now, when we received some detection kits, we tested it and it came out positive. So it's a what we call retrospective case, that way back case. It's not new case.
Okay.
Yeah, retrospective, way back.
The way back.
Yeah, way back case. We had that already, but we couldn't test it because we didn't have the chemicals, you know.
Okay.
Yeah.
So that case is it part of the 5 that we
that case now added to the 5.
To the 5, so we got 6.
Yeah,
okay.
That's where we came up with the number 6.
Okay.
Because previously we had been saying 5 until we tested it. Just recently we tested that.
Okay.
Since we received those testing kits, those chemicals, those water, and all the little things we can use in a laboratory to test the disease, to test for the disease. So once we tested it and it came positive, we said, okay, now we can report to the world that we had 6 cases. But that sixth case is not a new case.
It's an old
one.
Old one.
Yeah.
All right. So, okay. Do we have vaccination as the world population for Mpox, monkeypox?
Yes, there's a vaccination developed for Mpox. We don't have much of that in the whole world, so it's not just Liberia, but in the whole world. And there's one company that is producing it. So that company has been given, some money by the World Health Organization, by the United States and the European countries to produce more of that. Because this virus now is not just Africa. It has gone to the United States, it has gone to Sweden, it has gone to other countries in Europe. So it's all around, it's like it becoming to be a virus that is all around the world. So that is why with this outbreak, where when you have many people now start getting infected with it in so short a time, and in other countries, the WHO, which is the World Health Organization, which is our big ministry of health in the whole world, it then declares it as an outbreak of international concern, in that sense, just to shorten the war.
All right. So,
so vaccines are then produced, and once they are produced, the rich countries, as you know, they have the money to buy a lot of those.
That's why we're kind of going right now.
The so-called poor countries like Liberia and what we call developing countries now, they want to be politically correct globally. Developing countries which have less or no money to buy these vaccines, there's an organization called Gavi. This organization collects vaccines from all the rich countries, bring those vaccines together, collect millions of bottles, NPHILs we call them, or vials we call them. But those small bottles that you can see, they always
cut the top of it,
and put an injection thing inside and draw. They will collect most of them. Some rich people will donate money to this organization, and will use that money. The organization uses that money to get a lot of these vaccines, and then they will share it, distribute it to various countries. So we are waiting for that. That is why, before becoming NPHIL Director, far in the past, with my medical advocacy, I've always called for our countries giving some good amount of money to the budget that is assigned to health care. So the Ministry of Health should have more money given to the Ministry of Health. In that sense, then good number of money will be given to NPHIL, which is the public health arm of the healthcare sector in our country. More money will be given to the research arm, which is within NPHIL. Then we will not be dependent on the countries out there to send us vaccine. As soon as the thing comes, we can say, hey, we want to buy this amount. Once we have some, we'll start vaccinating our own people. Then before we say, Gavi, we did this one, but we are short of what we bought. Can you send us some of the free one you people got? So by the time they send us the free one, we're able to cover a lot of our, a good number of our people. So our consistent advocacy is to our lawmakers to please listen to us. Listen to the Minister of Health, Dr. Louis Poto. Please listen to me, Dougbeh Chris Nyan. Listen to other healthcare workers who will come to you to say, please increase our budget, because it's not for ourselves. All we are doing is to save our population. If all of us get sick, nobody will go to the ministry, to the Capitol building to go to work.
Yes.
Everybody you saw what COVID did to us.
Exactly.
You saw what Ebola did to us. So we don't want to keep coming to you. Please understand that when we have this money, then we are able to go ahead of ourselves to prevent these diseases, instead of us waiting the disease come before we start begging other people to give us money, to give us vaccine, to give us masks, to give us gloves. We can buy these things ourselves if we try to look at our budget and say, okay, pre-plan, yeah.
We need to be proactive, not reactive.
And that is what we are doing currently.
We are reactive.
Yes, but in a sense, we are now proactive in a way. Like you saw some of the measures that we have been taking. Once we heard about the monkeypox outbreak in other countries, we know that Liberia have had it before, right? From the history that I gave. In between time, we had little cases and outbreaks, but it was not as wide as we have with COVID or Ebola.
Yes.
So when we heard that in the DRC Congo, in the Eastern African country, DRC Congo, Burundi, Rwanda, and other countries, there is a wild outbreak. In the DRC Congo, you have about 27,000 cases. And then you have 1,300 plus people already died from there. Now, mind you, the DRC Congo is still suffering from other outbreaks like COVID, like Ebola. It comes out almost every time. In Liberia, we are suffering from the Lassa outbreak. We are suffering from other little diseases that are keep troubling us, right? Then when we add monkeypox on top of that, you know how much work we have to do in this country in terms of public health and healthcare, curative health. So we are really bowing down to our lawmakers and those responsible for creating our budgets to give us more money. So I speak here for myself and our big boss who is over all the healthcare situation in the country, Dr. Louis Poto, to really give, for them to give two of us. That two of us now, we are begging you to please give us money.
And I'm sure all the Liberians are. But let me ask this question. How much is one of those vows? Just give me an estimate or guesstimate on what it is.
I will be misquoting if I should say the price.
Okay.
Because
my reason behind it, I'm trying to get. That's why I say give me an estimate or a guesstimate. And
let's just put it this way.
Okay.
Let's just say, and this is what we call hypothetical situation.
Yes.
Right? When these companies produce these things, these companies themselves, they won't make profits, but some of them got group high.
Yes.
The same thing we talk about social corporate responsibility.
Yes.
So they just got group high. These are all human beings too.
Yes.
Right?
Yes.
And so even if they were selling it $5 for one, they would say, hey man, the poor country is plenty money.
Yeah.
I know we'll make profit from it, so some of our profit, let's put it in there so that we can sell it to them $1 per valve.
Yeah.
I'm just giving you a scenario.
Yeah.
So imagine if they are selling $1 per valve, and we say, okay, we are 5 million people, right? And we can say, okay, giving our own public health model that we develop most times, we say we want to vaccinate certain persons that will then form a ring around the entire population. Meaning when we vaccinate those people, they'll be able, their immunity will be able to prevent from coming, so then they will protect the rest of us.
Yes.
Right? So let's say we buy 1.5 million, $1, we vaccinate 1.5 million people. So $1.5 million, that's something I think we can afford, right?
Yes.
We can do it on the same spot, but we can do it
spread it out.
Yeah. We can say, okay, let's buy 250 million valves now. Then we buy 250 million later.
Mhm.
So in 4 sections we buy this, or let us say in 5, 6 sections we buy this.
Mhm.
By the time we buy this and vaccinate our people, before this virus break out, at least we are sure and safe that we have some level of protection and some level of range of protection around ourselves.
Mhm.
So I just want to give that scenario that if we have $1.5 million to go in for
Mhm.
vaccines, we are sure we can get lot of vaccines coming into the country, whereby when the Gavi donated vaccines come, it will be able to add up to what we have to vaccinate a good number of our people.
Okay. Oh, no. Okay. So like I said, one of my reasons why I'm asking the thing, I wanted to put a number so we can go so that I know we're gonna have some lawmakers listening to this, that we can say, okay, if $5 is for a vial, let them calculate that $5 for the amount of people. Let's say a representative can say, I got 10,000 people in my district.
Yeah.
So that 10,000 times 5.
Times 5.
Where you can say, okay, this is what I want for my district. For my district.
You're right.
So then another representative can say, I got 2,000 people in my district,
Right.
so we can allocate money so they can have a number, to put on it.
You're quite right. You are quite right.
You know.
And that is why I'm giving this scenario. So let's put it at $1 per vial.
$1 per vial.
Yeah, let's just put it that way.
Okay.
So you have 20,000 people in your district. Ask for $40,000.
Yeah.
You understand what I'm saying?
Mhm.
Because when we are giving these medications, these vaccines, let's put it that way, they're medication in themselves, vaccines. You may have situation whereby 1, 2, 3 may pull their hand and they may refuse to take it, whereby you already took it out of it, so you can use it on somebody else, right?
Yeah.
So that's why when you have 20,000 people in your district, ask for 40,000. Something like that. Ask for something over.
Yes.
Yeah. So our objective is if we can vaccinate, 1/3 to, about let's just put it this way, about 60% to 75% of our population, we should be good. We can also ask for smallpox vaccine. Then it can help us to cover that of smallpox because they are related viruses. The smallpox vaccine can also work up to 85% of the time. So we can be sure that we're covering a good number of our population.
Okay, I hope I can. I will try and send a communication out to the health minister to see if I can get the health minister to come on the show so I can ask some more questions of him too. If you can. Of her.
Yeah.
Correction of her.
I will get in touch with her and I can assure you I will put it behind her to come and sit in the same seat that I'm sitting in.
Please do. I have another question. Have you guys, you and the health minister, have you guys had an opportunity to testify on the Hill before the health committee for questions and stuff to be asked on the healthcare, on the health system or healthcare of the country?
Well, so far as I'm concerned, since I came in about like a week ago now, which is today, 5 days ago, we've not received any citation or invitation. But I suspect that we will be having that, or we'll be receiving that anytime soon. And I suspect they may be calling on the National Public Health Institute, which is primarily responsible to come up Capitol Hill and testify for public health according to the laws of this country. So we are waiting for that, and we look forward to that. Just recently, what was it, yesterday, day before yesterday, the information arm of our government invited the National Public Health Institute to come and say to Liberia, since you have, wider coverage than any one radio station or television station, to speak on that, and we spoke on that, and the entire country could hear what this is, how we catch it, what is different, how different it is from smallpox, what we are doing to secure our borders, and that's where we are coming to next to speak about things that the measures that we are now putting in place. So we did that. So the information arm of government already invited us to come and speak.
All right.
Now we are certain that the legislative arm of government will also invite us to come and hear from us what is going on and how can they intervene. Because most of the time we go, like I testified at Congress in
the US,
during the Ebola outbreak. We told them what Africa wanted, what Liberia wanted, what Sierra Leone wanted, what Guinea wanted, what Nigeria wanted. So we will go and tell our own legislature what is happening and how we can stop it. But with what the little resources we have now, we are then putting it into use in order to be proactive where we were before you asked the other question. So we can go to the next question.
Right now, when it comes to the defense of the monkeypox and let's say the smallpox, what is needed and how can we go about as a country, as a government entity that you need, and what is it that you need from the legislature, from the executive branch, and so forth, in order for us to fight this monkeypox, smallpox in our system?
With the resources we have on hand presently, what we have done is to work along with the Ministry of Health in order to begin to strengthen our surveillance and monitoring systems, meaning our watchmen there, the disease watchmen, they work with NPHIL, they work with Ministry of Health. So we say, hey, something coming, you wake up, get up, stand up. They are right at the gate, right? Yeah. So we activated them. That's our monitoring and surveillance.
Do you have do you have the people to watch to go out there? Do we have the human resources for that?
We have been building what we in the terminology called capacity. We have been recruiting and bringing in those people every time, on and off, and we have a lot of them, but we still need more. There's never a time where you can say, I don't need more people. Yes. Because you can never know when an outbreak or disease spread becomes wider than you think. So we have a lot of them. We still need more. Those ones that we have now, we are engaging in order to get them alerted to what is coming, and we have already done that. So the district health officers from the South, the Ministry of Health, our own officers, from the epidemiological side, our what we call epi-surveillance, meaning epidemiological surveillance group. So they are now all working together. We activated them, we told them, they know everything about it. So what we're doing also is then to visit our border points, which we call point of entry, where people come into our country. So the airport, they put up Monrovia. We will be going to the port of Buchanan. We will be going to the border in Cape Mount, in Nema, Lofa, and those places. We hope that we can. So we have already started touching those points. We went to RIA recently, and we put in place that system which was already there. We activated it, and we saw it working in real time when the aircraft came in. Now, mind you, in our region, we have two countries where we have seen fresh cases, right? New cases. In the Ivory Coast, we saw there are cases in the Ivory Coast that we know about. Ivory Coast is our bordering country. Yes. In Nigeria, just I think yesterday, it was reported that within the last 24 hours or so, as of yesterday, there were 33 cases. We don't know the new cases that they have now. So 33 new cases in Nigeria. Now, the traffic between Nigeria and Liberia, commercial-wise and family-wise. We know the traffic between the Ivory Coast and us. We are just neighbors. So we have begun to activate those point of entries so as to track incoming passengers and what we call triage them, meaning screen them, check them to see whether they have fever, they have any of these things on their skin, any rash, any bumps, etc. Then we'll put them aside and say, okay, you have to come on this side and you will be treated. We see those symptoms. There will be subsequent investigation, clinical investigation, epidemiological diagnostic investigation, to see whether they are
So
infected.
we currently have those at our
We have
airport.
and at the NPA, they are already active there.
Okay.
They are also active at our bureau posts, but we go in there to make sure it's working.
So
And
so
that's
are we
what
are we gonna have people? Are they gonna at the borders, Bullwater side,
Bullwater
Lo-Fi,
side.
and all those places? Are we're gonna have active
Yes.
people there stationed over there to do those
We
things?
already have
Oh,
active
we,
people.
okay.
Yes.
So they got it correct. We already have active people there
Yes,
right now.
Right now.
Okay.
And so we visit there to reassess because we already indicated to them that this is coming. So that's our activation process, right?
Okay.
And we alert them and get them to start working, to start being, instead the watchman is sitting down and just waiting, and you say, hey, we saw something coming, then the watchman stand up because you tell the watchman now stand up and start looking around.
Okay.
That's the same thing they are doing now. So we alerted them, the word we call alert. We told them, now they are all looking around to see what happened. Meaning if any people are coming through our borders, they stand there and say, okay, you come here, did you have fever in the last, few hours? Yes or no? Let's look at your hands because the things come right on your hands.
Yes, you can't hide it.
On your body, you can't hide it.
Yes.
As our people say, you can't hide better.
Yeah.
So that thing you can't
You
hide
hide
it.
it.
Yeah. So we look on your hands and see if you have it on your hands. The feet, most times they may be covered because of long trouser, long lapa.
You can pull it up.
Yeah, but the hands, you can see that clearly.
Okay.
And then the feet, you can pull up your, they have their way of doing it.
Okay.
We design a way of doing the screening.
Okay.
So they will do all of that. So they are currently active and we are visiting those border points in order to make sure that we cover that. Then we are asking WHO to send us vaccine that is in process. And then we got the diagnostic kits coming in recently, and we are still putting in for more diagnostic kits. So you can see that we are going ahead.
Proactive.
We've been proactive, that word that we use. We are acting before anything happens. And that's the essence of prevention.
Yes.
We don't want it coming before we start running around. So we're trying to stop it before it comes. And when we shall have done that, it will be a plus for all of us, for the Ministry of Health, for the National Public Health Institute, for a big good thing for the Liberian government, President Joseph Boakai, who in his turn will not see in this early stage a disease breaking out in the country because what he put in place, the people he has appointed to say, you look at my health ministry, you look at my National Public Health Institute. These people are working very strong and hard to stop any disease from coming in the country.
All right, so I'm gonna switch a little bit. We're still gonna be on the whole disease thing. I want you to educate us on communicable disease, non-communicable disease, negligence, topical disease.
That's an interesting area in infectious disease science and medicine. We have what we call communicable diseases and non-communicable diseases.
Yes.
Communicable diseases are those ones that can come from you and me, like we can transfer it. Let's just say fresh cold.
Okay.
Fresh cold is a communicable disease. You know the one we call fresh cold now. What we call colds.
Yeah.
Right? It's then what we call flu, influenza. Right? It's a communicable disease, meaning when I sneeze, I can give it to you because it's respiratory.
Yes.
Okay. COVID that we have is a communicable disease because you can catch it
from somebody else.
Non-communicable are those ones that you cannot catch from me, I can't catch it from you. So when we look at that, we look at things like high blood pressure. It's not communicable a disease. Diabetes. Yes, genetically, you can transfer diabetes from someone to another because of the genetic makeup, but it's non-communicable. It's not something that when you stand here, you got diabetes, then I will get diabetes too. No, it's not like that. Right, so it's non-communicable. I just want to use these two examples to distinguish between communicable and non-communicable. Now, the pathogens, the virus and bacteria and fungus that we are talking about, some are communicable, some may not necessarily be communicable. But where we stand now, going towards what we call neglected tropical diseases, like you were saying, those are diseases that have been communicable. We know they are, we've been catching those things for a long time, we deal with them, but now I know that we're forgetting about them. right?
Mhm.
Is that you have your child somewhere, you've been treating your child, send that child to school, the child reached the 8th grade, 7th grade, 9th grade. All of a sudden, maybe you travel, then you can send something back to the child. Then the child is then struggling. By the time you go low, almost everybody like forget about the child now. And like you forgot about that child, so you neglected that child.
Yeah.
And we don't want anybody neglecting their children. But that's a simple example we can give to tell you how diseases that we were paying attention to, all of a sudden, other diseases coming, they divert our attention, right? Ebola came, we forgot about smallpox, we forgot about chickenpox,
Yeah.
you know, we forgot about measles, we forgot about mumps, you know, we forgot about rubella, all these things. So Ebola
Lassa
came,
fever.
Lassa. It just took our head straight to Ebola. We forgot about every other thing. Then COVID came just, you know, after a couple of years again, and we forgot about these diseases again also. So that's where we come to start classifying them as neglected tropical diseases. All right, those are diseases that used to hit us. Now we forgot about them. So in our country, for example, things like chickenpox and smallpox, they are something we in our own medical milieu, in our medical scientific public health community, we can describe that as, you know, that we're neglecting those things, so because we are not paying much attention to them. Private children are not being vaccinated widely like we used to do long time ago.
Yeah.
But the Ministry of Health and us, we're working together, meaning NPHIL, in order to see how many children have been vaccinated since they were born, how many have not been vaccinated. WHO, we are getting some vaccine. Can you please give us more chickenpox vaccine, smallpox vaccine, and rubella vaccine, measles vaccine, so that we can vaccinate these children? So we are getting that, and vaccination process is going on presently as we speak.
Okay. All right. Okay. So and I know in Liberia, one of our leading causes of death in Liberia is malaria.
Certainly.
Right. And so we know that malaria is the transfer, from my understanding, the transfer, you know, because with lack of clean drinking water, dirty water sitting around, mosquito carrying it and stuff around.
Right.
I think one of the things I want to ask to educate us a little bit, to educate me and then our listening public and our viewing public.
Right.
What are some of the things that we can do, we as a nation, that we need to do? The small things. I mean, I can name some of it. I would say, you know, the people standing on the side of the road peeing, you know, in the area, dirty water sitting in the area, in a swamp area. You know, me saying it, or there's a politician saying it. Yeah. That I want you something that you, a doctor, a medical person, can explain it, so that people who listening, so they don't just classify me saying it because I'm so-called politician, but that come from a medical person.
Okay. Well, the thing is that we have been having malaria problem in our countries for a long time. I mean, it's like from the time Liberia, before Liberia was even created, mosquitoes were all around here carrying malaria all around. Malaria, as we know, is transmitted by mosquitoes. They are Anopheles. Those mosquitoes, we call them Anopheles mosquitoes. You know, and just like how everybody got named, they had a mosquito got named too. So it's transmitted by the.
They say if you don't love them, then you won't name it.
Exactly. And so it has that malaria parasite, you know, inside it. When it bites you, it injects the malaria parasite in you. That parasite we call Plasmodium. Now that Plasmodium, it got different types. It got falciparum, it got malaria, ovale, you know, the different type we need them. The one we have in Liberia is falciparum. That's the most one we have in Liberia. Probably we have other types here, and that's where the National Public Health Institute comes in, that will be investigating very deeply to see what other types that we have.
I'm glad to hear that. I'm glad that people. We are all glad to hear that you're over there.
Certainly.
Yes.
On our administration, we do intend going into deep down scientific molecular research. So we will take it from the public health angle, epidemiological angle, and dump it into the biomedical research angle. Then when we get the information, it goes to the Ministry of Health for our curative aspect of our health care, right?
Mm-hmm.
Then they will get the information. They will know, okay, we got a lot of falciparum in this area. We got a lot of ovale in this area. Oh, now we see why when we give the medication, it's not working.
Okay.
We got ovale is here, and this medication really target falciparum. So then, when we get that kind of collaboration, what we call collaboration, is what we need. Once we do that, that will improve our health system. So back to the whole malaria thing, and that is how the disease is transmitted. So once it bites you, they inject the parasite in you, the thing that caused the malaria.
Mm-hmm.
Then it goes through your blood, it goes to your liver, it divides itself, it becomes plenty in you. That's how now you start feeling the fever and all that. But where does the mosquito come from? Well, mosquito has been around. It's one of the insects that have been around
forever.
Where does it do all of this tactics that it play to bring the parasite to us? The dirty water that sits around, those dirty swampy areas, those water that you find at the back of your house, there where you see the mosquito sits, it lay eggs, it breeds, what we call breeding. There where it can be and lay egg and born a part of the baby there. All right. So when they become plenty, then they have enough to take the parasite. Now, like the army people of other countries, right? That's their gun. Those parasites that they come to shoot at you, that's their gun. So they take all these things, they can bite you and transmit it in you. That is why it's important that we look at your area. Don't let water to settle around your area. Mm-hmm. Those swampy areas that we have around us. Back in the days, they used to the mosquito spray that people used to have that thing on their back with the
spray. We still have that. They still do that right now.
They still do that.
Yeah.
So those are things that we are still doing to kill the mosquito. Because once you can kill the mosquito, then you start you can break that transmission chain. Mm. In other countries, they're using certain species of fish that they breed. So they breed those fish and put them in the pond, in this area. Those fish can eat the larva. When the mosquito lay the egg and start changing.
What are the fish? What kind of fish is this? We'll talk later offline. I will try and get that from you.
We can talk later.
Okay.
And it's been widely published. I just can't get the scientific, the scientific name.
Okay.
Most time I try to look for the simplest name to give. So, but we'll talk about later.
Okay.
Yeah. So that's the approach others are using. In the United States, the southern part of the United States, there used to be mosquito a long time ago. Malaria.
Yeah. In the South.
Yeah. In the South.
Yeah. South Carolina.
South Carolina.
Louisiana, yes.
Those southern states.
Yeah.
So they dealt with that. So we can do the same thing. What did they do that we can do in order to rid ourselves of malaria? Now malaria has vaccine now. The vaccine is on a trial and it seems to be promising. So there's a malaria vaccine now that we can take. We're still studying it to see how safe it is and how effective it is. But it's been difficult producing malaria vaccine as it was easier producing, then it was easier to produce chickenpox and smallpox vaccine and rubella vaccine. So because the malaria parasite is very, which is the plasmodium, it's very tricky, so in the medical biological sense, we say tricky because of the way all the places it try to go. Now to catch it at one point is very difficult. It comes in the blood, it comes in the liver, so it's hard to really catch it. And that's why even malaria medication that we use, the chloroquine, the artesunate, artemether.
Something with an A. I know when I was in the military, whenever we were traveling, there's a medicine they gave us. You take it once a day.
That's correct.
It's not with an A. I don't remember.
I don't know if it's amodiaquine.
I think so.
Yeah, but
it's purple, like a brownish looking one.
Yeah, that was for prophylaxis, meaning you take that before.
Before we deploy.
Yeah.
Then you take it for 2 weeks after you redeploy. Yes.
After you,
I take it now. Stuff right now. since I've been living in Liberia for the past about 5 years now. I have not going on 6 years. I have not gotten sick.
Right.
So
and this is the first time we are over air together, and I really want to at this point pause to say thank you very much, Majesty, for your service to the world. Majesty was part of the U.S. military, deployed all around the world at various points in order to ensure security, global security. And it's not an easy thing to deploy military people, to leave your family, to leave your children, to leave your mind, your power, and go somewhere else altogether, to stay there for years and years and then coming back. So those of us who live in the U.S. and other places, these personnel are our germ. We respect our army people. Same thing here in Liberia. We hope we are introducing. When you see that military person in uniform, respect them.
Thank them for the service.
Thank them for their service. Imagine we send Liberian military personnel to, I think it was Mali, for
yes.
peacekeeping.
Yes.
So imagine the time they stayed there away from their families. And we came out with flying colors. They represented us there well. They were one of the best
Yes.
or units or battalion or whatever you guys call it in the military.
That is all to the non-commissioned officers
Yes.
of the military.
Correct.
The backbone
Yeah.
of the military.
Right. And this was not the first time Liberia was sending its military out there to secure the peace. We sent them in Congo in the 60s. So Liberia has always been in peacekeeping as well. That is why when we had our civil war, which I describe as an uncivil war because it was not necessary. Right, it was not necessary at all. The whole war came to our aid because we have been contributing to world peace as well. Thanks to our Nigerian brothers who really stood the test of time, that sacrificed their lives. We are talking about military service, for our country to regain peace after we killed each other for 14 years.
And thank you, Doc. So I'm gonna give this my last question to you before we go. What is your vision in 3 years, 5 years, and 7 years that you think that what foundation you want to set at NPHIL that you want, that you think that will be that you believe that you want to leave your mark, your 3 years vision, 5 years, and 7 years. In whatever vision you have, I want you to share it with us, our listening public. What is it that you have? What vision that you have for NPHIL?
With what we met at NPHIL, with the situation, mine, along with the Deputy Director for Administration, Dr. Adams Lincoln, and the core of leadership that we have there now, all our division heads, and I don't want to name names now so that I don't leave out some other names. I go back on Monday and say, Dad, you didn't call my name. I don't want to get in trouble. So I'll just call out one name and then refer to the entire leadership, including our division heads, not only our division heads, even those who take care of our facilities, like Douglas, for example, who sweeps around, who makes sure our doors are locked, our security agents, our lab professionals, lab personnel, our EP surveillance group all around the country, and the entire NPHIL family. Our vision is not just me. Our vision, number one, is to create a really good professional working atmosphere. You know how it is, even in the military, when you have that professional collegiality, how friendly, relaxed everybody work, and then concentrate on our task at hand.
Yes, sir.
So that's number one thing, creating that professional working atmosphere, which comes with integrity, which comes with honesty in dealing with each other, which comes with openness, fairness in dealing with each other. That's the kind of atmosphere we want to create. The next thing we want to do is to really look at how our institution has been operating. They've done well in our epidemiological aspect where we check the diseases, we catch them, we detect, and that's it. We want to transition from there to diving into deep down biomolecular research, because that's what the institute, as a scientific institute, was created to do.
Kind of like the CDC.
Like the CDC. Now, the interesting thing is that
CDC, the Center for Disease
Center for
Control,
Disease Control.
in Liberia. We're not talking about CDC
Yeah.
political party,
No.
people. There's no politics here. So I'm just like right now, there's no politics talking
Thank you
here.
very much, because I always make that distinction.
No.
I always make that
It's
distinction.
Center for Control, Center for Disease Control in the United States.
Yeah.
That's what it is.
So NPHIL, interestingly, NPHIL is a combination of the Centers for Disease Control and the National Institute of Health in the U.S. So it's a combination of those two
Yes.
here. So we want to dive deep down into biomolecular research of the diseases that we are confronted with, of our healthcare system, why diabetes is the way it is, why is it now so plenty in our I want to get away from the infection,
Yeah.
because we tend to neglect those things as well. Why is it that somebody just walk in the street and pop the drop, and it may be from heart attack, and we don't know, but because that person just got through drinking with somebody, said the person drink, and the person.
Thank you, Dad.
So those are just in a nutshell. Those are what we want to concentrate on, so that NPHIL can begin now to contribute to public health in this country and in our region and globally. Thank you very much.
Thank you, Dr. Chris. Thank you, Dr. Nyan. It was a pleasure. I had a wonderful time with you today. To everybody listening out there, it was. I hope everybody was able to learn from what the great doctor came and said. And I would say again, this: you are one of the best appointments that President Mbeka have made. And it's a pleasure to know you. Like I said, you my uncle. So
Okay.
we don't want to go through.
I know.
Our relationship. Let's leave that.
We give a disclaimer.
Yeah.
And look, thanks to everyone that listened. Thanks to President Mbeka for the appointment. Thanks to the board headed by Dr. Stephen Kennedy, and the vetting committee headed by Mr. Walter Gwenigali Jr., who is the son of one of the most legendary medical practitioner in this country, Walter Gwenigali, Dr. Walter Gwenigali Sr., who passed away several years ago.
Okay.
Thanks to the entire board and to our NPHIL family and to our people in the Republic of Liberia. Let us all put together and help fight this disease.
Thank you.
Utilize all the preventive measures that we talk about. Wash your hands, sanitize your hands constantly, keep your distance. The same social distances we talk about during the COVID times, the same thing, meaning stop shaking hands too much. If you see, those symptoms.
Thank you, Dad. Thank you for everybody listening. Next week, we will have on the show somebody from the Social Security NASCAR. We have some for Social Security. We'll be talking about Social Security in the country. So please get your questions ready for us to have a very fruitful discussion next week with somebody from Social Security. They told me, say this person can answer a question. They be sleeping, and you wake them up and ask them anything about Social Security, they'll be able to answer it. And I'm studying for them. I hope they're listening today. I'm studying. I'm going to ask them all the hard questions. So I hope they are ready for next week. Thank you to everybody. Thank you, Doctor. Thank you for coming. To everybody listening on the radio, everybody listening online. Please share the show on Ku-Wor TV. When you're listening, please share the show. Please share the show. Please share the show. Thank you for everybody. God bless you. God bless Liberia, and God bless Africa. Thank you.
Good morning, Liberia. You're listening to the best show in the airwaves.